Mr. Chair, we're down to about 1 minute if you still want to proceed at 2 p.m. Mr. Chair, they're now saying 2:15.
Also, Mr. Chair and everyone else, I would note that the Senate is on their last bill. So there is a chance we'll be going maybe slightly before 2:15, but 2:15 is the time we've been told. Thanks.
Okay, we'll just go ahead and wait for them for another 15 minutes. Okay. Now, I do have one question to our staff. I'm currently showing that we are currently live streaming now. Is that correct?
Yes, sir, we are.
Okay. Thank you very much.
For the interest of transparency, we went live and we did put a message up stating that the Senate was still on the floor and that the meeting would begin shortly.
Okay. So just so that we're all very clear that we are currently live, and we will try to begin no later than 2:15, depending upon when the Senate gets out. So everybody, we're just in a holding pattern. Okay, thank you very much.
I guess it'd be okay to send the stewardess down for peanuts and Cokes.
At this time, we will be offering our beverage service.
just an announcement from the chair. I don't know if everyone can hear me or not. It's about 11 minutes after 2, and looks like we've been given a heads up that the Senate may be finishing up around 2:15. In the interest of time and in the interest of the time of the secretary as well, the committee will begin hearings at 2:15. And if the Senate is off the floor, they can promptly join us when they are getting off the floor. It may go longer than 2:15. We know how these things sometimes are a little bit more prolonged. So we'll go ahead and begin at 2:15, and hopefully the Senate will be able to join us as soon as they're off the floor.
Mr. Chair, we have reached 2:15. I'll go ahead and take the hold off of the meeting and we can proceed.
Oh, Ms. Wareham, can you hold 1 second, please? Just one moment.
Sure thing. Ready to go when you are.
In all transparency to the members of the subcommittee, I'm being advised as I speak that the Senate is actually doing announcements now, and we're just trying to get a read on how long it's going to be. And okay, a quick update. We are moving once again our start time to 2:30. So just hold steady for a few more minutes. It could be shorter than that, but we do know the Senate is leaving or finishing up on the floor, and our counterparts have asked that we get them to about 2:30 to see if they can make it at that time. So we'll just continue in the whole pattern. Thank you, everyone. We hope to get started very, very shortly. I see that at least one of the members from the Senate is online. And I do know that the Senate has completed their work on the floor. So hopefully in the next few short minutes, we can get our corresponding chair and members of our companion committee, subcommittee on the Senate and begin this hearing jointly. So just hold on. I think I'm getting word that they're actually logging on now.
Yes, sir. We do have Senate members logging on now.
Okay, thank you very much, Ms. Brown. Okay, Ms. Warheim, we're ready to continue our live feed. Just let me know when you're ready.
I am ready.
Okay. Good afternoon, everyone. My name is Delegate Keith E. Haynes, Chair of the Public Safety and Administration Subcommittee on Appropriations. We are a full subcommittee on the House side, and we are joined by our Senate companion subcommittee on the Senate side. We do apologize for the delay of about an hour, but as everyone know, and the public has been informed that the Senate was on the Senate floor taking care of floor business, and in the interest of getting through the state's business as effective and efficient as we possibly can under emergency COVID restrictions, we are holding these hearings jointly. So we wanted to make sure that we were able to ensure that the Senate members were online. With that, we're not going to delay any further. I'm going to go ahead and call the subcommittee, but I do want to ask whether or not Chairman McCray has any preliminary comments or remarks before we get started.
Just wanted to say thank you, Chairman Hayes, for giving the Senate the opportunity to be able to join. I see that we're joined by Senator Peters. We will be joined by Senator Saling and Senator Edwards momentarily. And just wanted to thank you once again, Mr. Chair.
You're quite welcome. So just so I'm clear, Mr. Chairman McCray, just so I'm clear, I didn't actually see the lineup from the Senate. Do you have a sufficient number to go ahead and begin, or should we wait for them to log on?
I have myself and Senator Peters. I'm actually calling George Edwards now. We rushed over here pretty quick to try to make sure we were trying to get here responsive. But I'm going to give him a call and check his ETA.
Okay, so are you saying that we need to hold?
No, please proceed. Proceed.
Okay. All right. Okay. And we will now have a joint briefing from the Department of Public Safety and Correctional Services of their fiscal 2022 budget overview. I do want to reiterate that this is an overview, and each of the subcommittees will have the opportunity jointly to dive a little bit deeper on some of the issues that may come up in specific departments or departments within the Department of Public Safety and Correctional Services. And so this is sort of the very high bird's eye view of what's going on. And there's one of our biggest agencies or departments here. So we do get another bite at the apple on some more specific issues. That having been said, I do want to welcome our budget analyst, Mr. Jacob Cash, who will be providing the analysis for us today. And I also want to welcome and At the same time, do apologize for the delay to our secretary, Secretary Green, Robert Green, the Honorable Robert Green, Secretary of Public Safety, and his Chief of Staff, Ms. Rachel Sessa. And along with them, we have Christopher McCauley, Deputy Secretary of Administration for DPSCS, and Ms. Carolyn Scruggs, Assistant Secretary for DPSCS. Mr. Cash, you can go ahead and begin when you're ready. Thank you very much.
All right, I believe I'm sharing my screen now. So, excuse me. Thank you, Mr. Chair. As you said, I'll be giving the budget overview for the Department of Public Safety and Correctional Services. And as you can see on the cover page, there is a budget allowance of $1.54 billion in fiscal 2022, which is a $17.5 million increase over the working appropriation. Now, this is a big budget, like the chair said, so I'll be starting with the issue section, which is regarding the department's COVID-19 response, and then move back to the budget after the issue discussion. So as everybody knows, there was a state of emergency declared in March, and all correctional facilities closed to the public on March 12th, and all parole and probation offices closed on March 31st. Administrative positions in the department that were able to transition to remote work, parole and probation agents transition to remote supervision activities, and in facilities, there was every effort to make social distancing available to the inmates. So there's obviously a budgetary impact with COVID. In fiscal 2020, the main upfront costs of the pandemic were given. So there's $11.3 million in medical care, $23 million in housekeeping expenses, and $28 million in personnel funding. That mostly goes towards things like premium pay, which was offered in March and doubled the payments that correctional officers were given. They offered response pay up until September 8th, which provided a $3.30 per hour increase to facility employees. And those who were working in quarantine areas made an extra $2 on top of the response pay. Now, in fiscal 2021, the upfront costs from housekeeping weren't reflected, but there are still personnel costs of about $29 million for those same response and quarantine payments. And there is $6.7 million in general fund deficiencies for other COVID-19 costs. About these reimbursements, they were from the Maryland Department of Health, which has the coronavirus relief funds budgeted in them. So they are federal dollars that are being rerouted through state government, but they are reflected in this budget as reimbursable funds. So about the medical contract, some of you may be familiar with this issue, but DPSCS negotiated an increase to the standard payment given to the contractor. It's a fixed rate cost, meaning as the inmate population varies, it's been on the decrease, but the contract amount doesn't vary with the inmate population. So in order to allow the medical contractor to have an adequate response, DPSCS negotiated a 33% increase to their monthly payments. This lasted until June 30th and totaled $11.3 million. And at the July 1st Board of Public Works meeting, BPW unanimously rejected this model and ordered the department to pursue a reimbursable model that can be audited for expenses. DLS believes that about $12 million in additional funding in fiscal 2021 will be needed by public safety, and those are likely to be covered by coronavirus relief funds. The population also decreased because of the pandemic, and there was an order from the governor to the Maryland Parole Commissioner to review cases. The Justice Department the Judiciary and administration there also reviewed cases. And they released about 15,500 individuals from March 1st to December 30th. They were either placed on bond or supervision, pretrial supervision, or parole or unsupervised release and home detention. Specifically on home detention, those placements increased 155%, and on pretrial supervision, those placements increased by 160%. Exhibit 8 shows the population decline because of COVID-19, and the top red line shows the correctional population. Specifically, they declined by 2,800 inmates, while in pretrial detention, we actually saw an increase over this time, and that's mostly because the judiciary has many delays currently because courts simply can't process all of these cases during the pandemic. There's also wide testing in the department, and that began in March. They were initially only being tested where there were active cases in the department, and it's called point prevalence testing. However, beginning in May, they started systematically testing every correctional employee and inmate. Unfortunately, there have been 4 staff and 20 inmates who have passed away due to coronavirus. And Exhibit 9 shows the active cases over the course of the pandemic. These take the positive cases reported by DPSES minus the recovered cases. As you can see, the peaks were in the summer and in the fall. They have gone back down in 2021. However, this is still a concern and an issue for the department, maintaining low positivity among staff and inmates. There's actually been a couple of good things to come out of the changes, specifically the increased collaboration between judiciary and DPSES has been very helpful for them, and they may even, they're seeking to continue certain virtual court appearances, which are cost effective, they're time saving, and they are safer. There's also more possibility for remote work to be used in regular operations of the department, and that can save funds in rent costs, which we'll see in this budget that rent costs did decrease. And you can also see a wider variety of candidates being able to apply for those positions. And we're asking public safety to comment on their overall response, provide information on their spending, their population reduction strategies, as well as the operating procedural changes. The other obvious future step for the coronavirus response is vaccinations. They began in early January, and so far, 3,250 first doses and 188 second doses have been administered. Their total combined doses allowed and that have been delivered as of February 1st are 13,650. So about a quarter of doses have been administered so far. And we're asking public safety to comment on their vaccination efforts, as well as the timeline for reaching full vaccination. The second issue we're talking about is an issue that most of you are familiar with. This is hiring for public safety. And from January 2015 to January 2020, there was a dramatic decrease. And you can see that in Exhibit 10. The number of employees at the department were in a trough during last session in January 2020. You can see the low point in public safety employment, but it has steadily increased, slightly increased, but steadily this calendar year. We can see vacancies by classification, and now those two big drop-offs are because of position abolishments, and that's mostly what I wanted to talk about here. The department has improved hiring, but the biggest change in the vacancy rate actually has to do with positions being abolished. Vacant positions, over 1,000 in the past 3 years have been abolished. And that includes the fiscal 2022 allowance, which abolishes 350 additional positions. Looking at the number of correctional officers who were hired in 2020, we're reaching back to previous years when we were at good staffing levels. As you can see, 2016 had the lowest amount of correctional officers hired on record. And in 2020, there were almost 500 hired. With those hires and with the 278 separations they had for correctional officers, they did see a net increase in correctional officer employment, and in overall employment. And last year, we talked about the hiring gap since 2015, that low year in hiring. And like I mentioned last year, that shaded area in the back needs to be going down in order for things to improve. And that's what we're seeing in 2020. They have hired more correctional officers than separated. And as we see in their budget, and I'll point out in just a few minutes, overtime decreased by about $10 million for the department. So we're seeing benefits from these changes. This shows a monthly view of the hires and separate, or the monthly gain versus loss of correctional officers. And every year in this, or every month in this pandemic, except for July, there was a net increase in correctional officers. And that's very different from what we saw in the past. There are, however, concerns because this happened during a pandemic. They did start before the pandemic at improving their hiring. However, all of the net increases occurred during this calendar year when the state and the department was under very different conditions than they normally are. Especially, the department tends to agree, and DLS has tended to agree in the past, that during periods of economic hardships, correctional officers are easier to recruit, and during times of economic boom, correctional officers are harder to recruit. The actual data do support this to an extent, but obviously it's a complicated story. The main concern here is that after the pandemic is over and the economy is better, that the department may see issues again recruiting correctional officers. That's obviously something we would like to avoid. So DLS is asking DPSCS to comment here on its strategies to maintain adequate staffing after the economy recovers and after the temporary incentives they have for employees to stay on the job expire. The third issue to talk about today is the Justice Reinvestment Act. Now, this shows the first 3 years of implementation, which began in October 2017. And in that third column, the third year, you see the results from October 2019 to October 2020. Medical parole was used more this year, which was good to see for the coronavirus pandemic. However, we could have seen more medical parolees out of the 98 screened, or you would expect to see more due to the safety issues, the medical safety issues with a viral pandemic. In terms of cost avoidance, this was calculated by the department, and I'll point out that the calculation changed this year because the variable inmate cost is lower, and that's because the inmate medical contract is fixed. It doesn't decline as the inmate population declines, so they removed it from the calculation. In years past, it was included because it did decline with the inmate population. However, what we're seeing now, we're almost comparing apples to oranges because we're not considering the total amount that's going into keeping offenders safe and in custody. However, using the calculations as they are, DPSCS estimated in fiscal 2020, they avoided $921,000 in costs associated with inmates who were released early as a result of JRA. Now, if we can move back to the budget discussion. As I mentioned, there's a $1.54 billion budget in fiscal 2022. As you can see in this cover page, in fiscal 2020 and in 2021, there's the reimbursable funds in purple, which represent coronavirus relief funds. The overall budget change was $17.5 million, as I mentioned. And the largest changes occur actually in the 911 pass-through fee, which increased $38 million in special funds. So when you consider the overall budget change between 2021 and 2022, consider that while it appears to be level funded, $38 million of that is actually special funds that don't have anything to do with public safety operations. They have to do with the local operations of 911 centers. So in terms of actual operations for the department, funding is on the decline in 2022. Another issue that we should certainly talk about today is that the Southern Maryland Pre-Release Unit and Eastern Pre-Release Unit are scheduled for depopulation and closure by the end of fiscal 2022. They have $0 in their allowance. The facilities have a combined average daily population of 164 offenders and 76 field employees. Now there is BRFA language, the Budget Reconciliation and Financing Act, language that will guarantee that those positions will be transferred to other facilities without loss of compensation or status. However, they are about 50 miles from other facilities, so this could be an issue. Personnel expenses also declined by $6.8 million on net. That includes increases for health insurance, as well as decreases in other areas. Regular earnings, for instance, decreased by $2 million, and overtime decreased by $12.4 million. Overtime, as I said, is reflected by, or is impacted by correctional officer hiring, and those improvements have reduced it this year. The vacant positions in the 2 pre-release units that are closed caused about $800,000 in cost savings, and the non-personnel expenses actually have been recalculated, so this 5.2 million is wrong. It's about $2 million, and that's because this estimate included inmate medical costs when it shouldn't have. Those are fixed across the department. Non-personnel expenses saved that aren't transferred to other parts of the department are only about $2 million for these closures. And in personnel, we touched on this, of course, in the second issue. However, I'd like to be explicit about the allowance. It's 9,601, but 350 will be abolished. So the overall allowance will be 9,251. It's 3.6% decrease from last year, and it will bring the overall vacancy rate to 12.6% if staffing levels remain consistent. With the budget, it allows for about 83 positions. When you take out the abolishments from the pre-release units, it's about 71 extra positions, or about $5 million using the departmental average. That would be $5 million available for adding filled positions rather than just staying at current staffing levels. Now with that, I believe I've gone through most of what I wanted to talk about, and I'd be happy to answer any questions that you have or talk more about any issue that you have. As the chair said, this is a large department, a large budget. It will be getting into more details in some of the other analyses. However, I wanted to provide, a sky view overview of this budget.
Okay, thank you very much, Mr. Cash, for such a thorough analysis. Are there any questions from the members of the House Subcommittee? Seeing none, hearing none, Mr. Chair, Chair McCray, I will ask you to call on any of the Senate members if you have any for questions.
Senator Edwards. Thank you, Mr. Chair.
You're welcome.
Edwards.
Thank you, Mr. Chair. Can someone let Senator Salling in? He can't seem to get into the screen. So if someone working the screen can get Senator Salling in.
Yes, sir. Cherry, do you see Senator Salling?
I do not see him in the waiting room.
We'll make sure he get the correct link, Senator Edwards. I'm going to give him a call now, and I'm going to make sure Will coordinates with him that he got the right link.
Okay, just come over and say he couldn't get in, so I thought I'd touch base this way. Thank you, Mr. Chairman.
Yes, sir.
Okay, seeing no further questions, we will now turn to the Department Secretary, Secretary Green. And we've already called the panel that's with you, so you can go ahead and begin your response whenever you're ready, and welcome.
Very good, and thank you for having us. Good afternoon, Chairman McCray, Chairman Haynes, Vice Chair Proctor, members of the Senate Public Safety, Transportation, and the Environment Subcommittee, and members of the House Public Safety Administration Subcommittee. For the record, my name is Robert Green. I'm the Secretary of the Department of Public Safety and Correctional Services, and as noted by the Chair, we're joined virtually today by Deputy Secretary of Administration Chris McCulley, Assistant Secretary Carolyn Scruggs, and Chief of Staff Rachel Sessa. The department appreciates its ongoing collaboration with the Department of Legislative Services, and always we appreciate Mr. Cash's hard work and his thoughtful analysis. In the analysis, the Department of Legislative Services asked the department to respond to 3 issues. There is quite a bit to cover here, and I will do my very best to cover that expeditiously as possible, but also as completely as possible. I would ask if the subcommittee staff could permit Chief Sessa co-hosting abilities, please. We have some slides that I'd like to bring up when we get to population trends and how COVID-19 has impacted our operations, as well as the other 2 issues. I'll begin by addressing the first piece of the first issue DLS asked us to comment on, which is the agency's COVID-19 related spending. For fiscal year 2020, the department spent a total of $25.7 million on COVID-19 salary enhancement efforts. Fiscal year 2021 through the end of January 12th pay period, the department spent a total of $30.5 million, and we anticipate spending an additional $23.9 million in salary enhancements to complete the remainder of the fiscal year. So fiscal years 2020 and 2021, the department will have spent roughly $80 million on COVID-19 salary enhancements. There are, however, additional COVID-related expenditures. In FY20, the department spent $39 million on non-salary related COVID-19 expenses. The majority of this went towards purchasing PPE, gloves, various styles and types of masks, gowns, N95, surgical masks, and other equipment to allow us to operate safely within our environments across the state. In May, the department was looped into the bulk purchasing practices of MDH as well as MEMA, and that's where we do that now. $24.7 million of the $39 million went towards purchasing PPE. But again, since we have been part of the MDH and MEMA efforts, the department has not had to purchase these commodities. The department has not spent anything since the initial $24 million on PPE. The remaining roughly $14 million of non-salary related COVID expenditures in fiscal year 2020 went to items which would include inmate medical health care and behavioral health care, deep cleaning, disinfection services, as we noted, housekeeping supplies, janitorial supplies, dietary issues, meal enhancement, as well as increased maintenance cost across our system. So in fiscal year thus far, 2021, the department has spent $2.6 million on these high-level disinfection services to slow the spread of COVID-19, and the department estimates spending an additional $5.8 million through the end of the fiscal year as we continue to deep clean and mitigate the pandemic. The department also has $7 million in planned inmate medical expenditures directly related to COVID-19 and has received confirmation that these expenditures will be covered under CARES Act funding. At this point, I'd like to ask Chief Sessa to share the visuals we put together that address the remaining part of the first issue, which is the impact of COVID-19 on the agency's operation and some population trends, as well as the other 2 issues we were asked to comment on. COVID-19 has had a significant impact across every facet of this department's operations, jails, the Division of Corrections, our community supervision programs. Nothing has gone unaffected by this pandemic. Safety and security of our staff, the men and women that do this work, as well as those that are under our care, is and has been our absolute priority from day one. How do we mitigate the spread of COVID-19 and save lives? The department remains extremely committed, diligent, vigilant to the COVID-19 mitigation response efforts. We continue to work closely with MDH to stop the spread. We continue to look at every evolving practice, from testing to including the utilization of wastewater monitoring to help us detect asymptomatic spread. Next slide, please. A key element of our prevention, as noted by Mr. Cash, has been increased utilization of diversion programs, reducing the population density within our system. And while this is an element of pandemic response, it is also an element of a change in community reentry, a focused response of how we send and connect people to communities. The department operates its own home detention program that supervises incarcerated individuals within our system who are approved for community placement prior to expiration of their sentence. Individuals are eligible for this home detention program at no cost, and the Division of Corrections has the authority to approve or deny placement. The department's been expediting these placements of incarcerated individuals within our system to home detention, and as the chart shows, placements have increased by 155% compared to last year. And again, while we're in a pandemic response, this is also part of a planned reentry focus that we spoke to last year, and we continue to grow across our department. Next slide, please. Pretrial supervision, as we've noted previously, is a function of local jails. As you know, the department is responsible for the Baltimore City Jail Complex, and we run a very robust pretrial supervision program within the city. After conducting interviews and investigations, the pretrial release program provides recommendations to the courts concerning the pretrial release of individuals accused of crime in Baltimore, and this is managed at no cost to the individual. This program, again, nationally recognized, has tremendous successes, a significantly low failure to appear rate, and rearrest rates for those under supervision, again, very low. This program's data is monitored daily and how it's being utilized. As you can see, the pretrial release supervision placements have increased by 160% since March of 2020. It is important to note the local jurisdictions also have the statutory home detention and pretrial release program provisions. Next slide. This will speak directly to the diversion and reduction of the density of the population across our system. From March 1st, 2020 to December 30th, 2020, there have been 15,487 individuals that have been deflected or released from custody. DPS custody greatly assists us in the mitigation efforts, again, in decreasing the population density within our system and appropriately supervising people outside of the facilities. 4,695 individuals were released directly from booking in Baltimore City. 5,437 were released from pretrial detention prior to any sentence being imposed. 955 individuals were transferred from facilities into the custody of our home detention program and our community reentry efforts. And 4,398 individuals were released from sentence custody across our system. Next slide, please. Over the past year alone, the department's average daily population has declined nearly 12 times more compared to the same period of time last year. And the current population is just over 18,000. We closely watch this population data and these trends. I would note, as illustrated by our DLS analysts, the decline in population that we have seen has largely been within the Division of Corrections, our long-term maintaining facilities. It's important to note, while this trend is encouraging, it is likely a bit of an anomaly due to court closures and overall impact of the pandemic on the criminal justice system, and we continue to stay closely focused on that with our criminal justice and court colleagues. Next slide, please. COVID-19 testing. The department rapidly stood up testing and then proceeded to dramatically expand the testing across our system. Our capacity and our protocols, again, dramatically expanded. The department first conducted tests, as indicated by our analyst, of symptomatic inmates according to the CDC and MDH guidelines, and we began that in April. In accordance with the governor's announcement and MDH's guidance on May 20th, shifts in testing methodology occurred, and we went towards wide-scale, targeted, and asymptomatic testing, and that began throughout our entire system. Currently, as of today, the department is testing its facility staff on a monthly basis, with the exception of the Baltimore Central Booking and Intake Center, where staff are tested on a weekly schedule. We've also implemented a rapid test program at the Baltimore City Booking and Intake Center, where individuals are tested for COVID-19 prior to entering that facility. It is a process external to the building in a tented structure that allows us to gain that information of testing prior to coming into the system. The department is also currently completing the 7th round of monthly staff testing. The department also conducts serial testing, incarcerated population on a weekly basis, and also upon intake to our system. That intake would include individuals that are transferred from local custody to serve a term of confinement within the Division of Correction. The department's inmate medical contractor implemented targeted serial testing in August of 2020, and since then, over 33,000 have been administered across the general population, as well as the chronic care populations who are more closely monitored due to medical complications. We're in our 22nd week of serial testing inmates and have tested approximately 1,600 per week, including outbreak detection testing and transfer testing. Next slide, please. This slide just quickly illustrates both the progression of our testing from symptomatic testing on your left to where we went through targeted, universal, and monthly testing. To put a very fine point on it, as of January 25th, 2021, the department has administered over 99,500 COVID-19 tests. Next slide, please. This slide will illustrate for the committees the positivity rate among the correctional facility staff in comparison to the 7-day Maryland statewide and community positivity rates. The most recent prevalence testing, which was conducted January 26, indicates that our correctional positivity among staff is significantly below community spread rate. We work diligently to achieve that. We know that our staff, those entering the facilities, present vectors of exposure, which is why we issued the PPE very, very early on in April and have maintained a significant supply so we can continue to mitigate the spread of COVID-19 through our systems. Next slide, please. As noted, the department continues to fight the spread. We have daily leadership meetings. Those meetings are not just DPSCS, they're attended by MDH leadership and other leadership that may have a issue, a protocol, a piece of the puzzle that continues to help us mitigate this pandemic. We meet monthly with the courts and community stakeholders wherever we need to continue to maintain our evolution of, quite frankly, learning at every corner what we can do to better manage ourselves and our situations. I would tell you a key point to this is also our COVID-19 compliance review teams. These are environmental safety officers, nurses, individuals that enter our places of confinement, look at the facilities. We've done 140 multidiscipline reviews. And we learn. We make sure we're doing what we say we're doing. When we're not, we make an adjustment and we look at what we can do better. It's continued compliance, and I would note continuous quality control to be the best that we can. We took swift action at the beginning of the pandemic. As noted, we've talked about the sanitation efforts, tripling, doubling down as pictured. We're talking about deep cleaning, and I won't go into great detail, but the CDC guidelines around this type of cleaning are noted. It allows multi-surface cleaning, porous surfaces, high-use areas, and we have a lot of still, even under a COVID pandemic, movement of staff inside and outside of facility, and we want to make sure that these surfaces and these areas continue to stay clean. And we do everything we can to slow the spread. This slide would note we've conducted 460 of these professional deep cleanings, whether they be in a DPP office, a facility, one of our offices at our RPOC facility, wherever we perhaps have had spread, we have contact, we have community contact. We want to make sure that we continue this we believe it's paid significant dividend for us. We've created zones inside the facilities for the purpose of cohorting individuals, protecting them, separating, zoning facilities, have negative airflow housing units that are dedicated to the isolation and quarantine bed space. And again, noting that we monitor those spaces every day and respond to what is happening in our facilities. I would note that Maryland was one of the very first states, along with MDH, to deploy the surge hospital tents, which are pictured before you. These surge tents have been utilized by us as the toll of this pandemic continues. It allows us to provide an opportunity for convalescent care for individuals that do not need intensive care, but need additional care and or treatment. It reduces the impact on our hospitals across the state of Maryland as possible. So this has been, again, a very good program for us, and one that continues to evolve to this day in utilization. As noted, to keep the incarcerated population and their loved ones connected, we've deployed a great deal of technology. We've re-imaged the way that we want to and assist the population, individuals, in keeping connected to family. Virtual visitation is something we put in place very early on. It has been highly successful. It's offered at no cost to the inmate population. And it is my full intent that this type of visitation will continue to allow individuals to remain connected to each other. We've continued the 15-minute free phone calls, which again, keeping individuals connected is just so important. We also drastically developed new methods of telehealth, telepsychiatry to better treat the incarcerated population, be able to treat individuals in place, be able to stay connected. While it does not take the place of the direct staff that have and will continue to be present, it has been a significant extender of what we are able to do. And again, we wish to continue that and grow it. The second issue DLS asked the department to comment on is our vaccination efforts. I would tell you, I couldn't be more proud of the vaccination efforts and the work that we've done. As announced by the governor's press conference on January 5th, public safety and corrections was included in phase 1 of that vaccination prioritization plan. And you have that plan before you. Specifically, phase 1A included medical personnel working in our facilities and our correctional staff. We were afforded the ability, based on, quite frankly, we worked very hard to establish an efficient testing process, which yielded a good flow. And we used that same testing methodology to roll out vaccinations across the state directly at our facilities. We began January 6th. We held our first vaccination clinic the day we received our first allocation, vaccinating the vaccinators, if you will. And we've conducted a first round of vaccination clinics. No one was turned away. All that wanted them were able to come. And we vaccinated 3,268 individuals across the state. Our occupational health staff continue to bring these clinics directly to our employees. It allows ease of scheduling and ease of access, while again maintaining custody, security, and direct contact with our facilities. We're holding them at every region across the state. Next slide, please. I would note, in this picture, these are our staff. We've utilized vacant facilities. We've stood up existing structures that we have across, and again, pictured our staff waiting post-vaccination prior to departing. We believe this has alleviated some potential strains on local health departments, but again, has made our clinics well received and accessible to the staff. Our staff was included in 1A, but they also can seek the vaccination, as you know, in local health departments or under other processes. In fact, anecdotally, we know that there have been our staff members that have received the vaccine outside of our clinics, and we are appreciative that all of our staff, and hope that all of our staff will pursue vaccination. Nearly 1 week ago, the team began to administer the second dose. So we are already into second dose vaccinations of that 3,268 individuals. Last week as well, the department completed phase 1B as our medical treatment providers vaccinated the 75 and older incarcerated population. And we are actively right now in the process yesterday, in the 65 and older populations within our system and doing them in a priority fashion. The third and final issue DLS asked the department to comment on is our strategy to maintain adequate staffing. And I would note, while I think this question is a bit misleading, if I may, the department was making excellent strides in terms of hiring well before the state experienced this pandemic. I made a personal commitment, as did the staff, that we were going to change the trajectory of hiring. And I know we have that left to continue to prove, but looking at this graph, we've demonstrated an increase in the number of hired officers in 2019, and we've kept that momentum through 2020, despite the challenges brought on by COVID-19. It's a change in narrative. It's a change in focus. It's outreach. While I'm sure economic factors will and always play a role in the employment that people select, we've also taken a strong regional approach across our system to engage individuals. We suspended in person, but we adapted. We reimagined that entire recruitment process, and that work will continue. And where necessary, where there are still face-to-face components that have to take place, we're doing them safely, and individuals that are engaging in employment with us are coming. Despite all those challenges, the department faced during 2020, that we've hired 703 new employees across all sectors, 491 of which have been correctional officers. Last month, January, we hired an additional 52 correctional officers, and we have over 60 more in the pipeline for our February class. Our utilization at the academy has been incredible. That's 112 new correctional officers during the first 2 months of 2021 alone. We're better at gauging people. We have multiple pathways to employment with the state, and our messaging is, I think, significantly different. I'd be remiss if finally I did not mention that the department has a bill before the Senate Judicial Proceedings Committee. We introduced it on January 14th that will also assist us in establishing additional pathways. It's Senate Bill 44. It would alter the age at which the department can seek to engage a correctional candidate, from 21 to 19. It creates no lower bar. It creates no fast path because you are 19, 20, or 21. It allows an individual at the age of 19, which is the majority hiring age, 18 actually, within our state, to engage the process. Doesn't guarantee them anything. And we know that not every 19 nor every 25-year-old is made for this work, but it allows us, I think, very equitably across our state, individuals, good state jobs that have incredible benefits that this group has and others have made sure we have, to make a conscious choice to start a career a bit earlier. Mr. Chairman, that concludes our testimony. We're happy to answer questions, and we greatly appreciate the time you afforded us.
Okay, thank you very much, Mr. Secretary. Are there any questions for the Secretary from the House side? I see Delegate McKay.
Thank you, Mr. Chairman. I appreciate the opportunity to lower my hand. Mr. Secretary, good to see you. I have been following your good work here in Western Maryland with, I've attended a couple of the job training or the job fairs that you've had. Really like to see the bar graphs going in that right direction. I think it's important to state that I saw that firsthand in Western Maryland in the couple of facilities we have here, that was going up before the COVID hit, and sending it in the right direction. And while right now is not the time, but we do need to discuss that issue. We'll drill down to it of the Board of Public Works and those contracts. So we look forward to having more conversation with you in the future. I just wanted to let you know as we go forward, we'll discuss a little bit more there. I do have some concerns, not the time to do it right now, but look forward to meeting and talking to you and your team about that. Thank you, Mr. Chair.
Understood. Thank you.
Okay, Chairman McCray, I would turn it to you to see if there's any Senate members with questions.
Yes, sir. Thank you, Mr. Chair. Senator Edwards.
Thank you, Mr. Chair. Mr. Secretary, good to see you.
Thank you, sir.
I want to thank you for your working with the District 1 delegation and District 2 delegation over the years, where you have several very large facilities, and probably the worst of the worst in the state as far as the people that's in the one, North Branch. And it's good to see the numbers going up. I know we've met many times and talked about ways to try to increase hiring in facilities overall. Follow Delegate McKay's comments there. Can you, you don't have to do it now, but maybe you can send us some charts or something, break it down. Where are they starting, going back a little while, the new hires are gone. I mean, how's it going? Sometimes it looks good across the state, but certain parts aren't going as well as getting people on board. So can you break it down? Like I said, send us a chart or something of the 2 prisons in Cumberland and the 3 in Hagerstown, so we can see the direction they're headed, or are they harder to get people now than some other parts of the state?
Yes, sir, Senator Edwards. We have that broken down by facility, and we'll be pleased to provide that to you very quickly.
Thank you very much. Thank you, Mr. Chairman.
I think it looked like Senator Sailing didn't put his hand up, but he's physically throwing his hand up. Senator Sailing.
Yeah, sorry about that. I went over there and tried, and for some reason it wouldn't let me. I don't know why, but thank you very much, Mr. Chairs. I want to thank you on the screen for all the information. I would like the same thing if we could. I guess all would like to have that information and where we are lacking.
That's the mail.
I know we've been so far behind, and we've been trying to catch up. So if we could find that also, it would be really helpful. And I want to thank you for the information. Thank you.
We'll be happy to provide that. And again, I'm pleased with the progress. We're not done, and we claim no success. We will keep our foot on the pedal and keep moving this issue forward. I promise.
Thank you very much.
And Secretary Green, first, just want to say thank you for your leadership. I read a number of the reports that come out from your agency, and I know how thorough and just what's happening under your tenure. And I know that is not only done by your leadership, but also you have strong staff that work with you. I'm going to ask a question, and then I'm going to follow with the analyst with some information. Do you all have ratios in reference to inmate to correctional officers with your profession?
That's an excellent question, Chairman McCray. And there are, depending on the design of the facility, there is recommended ratios in a direct supervision environment, depending on the classification. And it is also established through minimum, medium, and maximum security classifications. So we have a staffing plan. And as you know, statutorily, we must do a staffing analysis each year. We're preparing to do that again now. And I frankly believe with where we're at now, starting to move to fill a lot of these vacancies, a staffing analysis will have much more creditable information than when we're in such a staffing problem that you're burning lots of overtime and specialty posts. So we're hopeful that that's going to help us move that direction, but we very much can provide how a facility is staffed based on its classification and the movement of that facility. Be happy to do so.
Yep. And the next one is comments, more or less. I'm going to educate myself on this, Secretary Green. I look through the reports and I see the trends in good directions because of the great work of the Justice Reinvestment Act, because of the hiring that you're doing. But I don't fully understand the correlation of the staff versus the decrease in inmate population. And also, I just want to make sure that our budget analyst, Jacob Cash, so I got a full understanding of like the building. So I know that a lot of times when we drop down an inmate population, we also see that the building space isn't all necessary per se. So I just want to kind of deep dive and for my own purposes, kind of get to understand that a little bit better. So he will request an information just so that I can help myself, educate myself. Thank you again for your leadership.
Thank you very much, Chairman.
Mr. Chair, that was the last question that I see from the Senate side, so I'm gonna swing it back to you.
Okay, thank you very much, Chairman McCray. Are there any further questions from members of the subcommittee on PSA? I don't see any. I do have a couple of questions. I just wanted to follow up. We've been looking at this over the last few years, and I just wanted to dive a little deeper, if I can, today on the vacancies and the hiring trends and the initiatives. And what I wanted to ask you is this: can you give me a real picture of where we are with hiring when you put these sort of three components together? Hiring versus those individuals who may be separating from the system for whatever reason. What is that true number? And that number versus comparing that to pins that may have been deleted or vacancies that may have been done away with. What is that number the same as what's reflected in the analysis? So you understand where I'm coming from?
Yes, I do, and I believe one piece of that question was covered by our analysis chairman, or our analyst, I'm sorry, Chairman Haynes, when he talked about the net gain. So the net gain between that which individuals departed and I think it was 126 maybe the number. I think we need to delve into that a bit more, and I think we need to look at, for me, the narrative of why people do leave. In public safety and in my career of 36 years, we have people that will come into a system, engage a system. We have officers that'll go from correctional officer to case manager. So that's, while it's a departure in a correctional officer, it's a case manager growth, or they'll get their social work degree. Or perhaps we have young individuals that come into the system and choose to take a public safety position. Perhaps they go to law enforcement. That's another change that we see. And I would tell you, I wish they would stay, but I will also tell you, sir, that I think that kind of progression creates an individual that understands how to talk to people. And if we can be part of a continuum of good public safety leaders growing across our state, we want to be part of that. I think that's been the difference for us, our messaging, people seeing who we are, not what they think we do. So if I may ask, if we could work with the analyst as well as our HR staff and give you a very detailed answer to that, because it's not as clear as, this person left. They may have left within the same department or with another state agency, which again, is not always because they didn't care for the work. It's because the person aspired to grow in an organization.
Okay.
And if I may, just Secretary Green, just to kind of just to add on to that and piggyback a little bit, Chairman Haynes, as a part of our monthly joint chairman's reports that we submitted in terms of hiring, and we can certainly happy to summarize that information that was submitted over the course of 2020. But we did track absolutely the retention strategies to include the promotional processes and how Secretary Green was mentioning officers tend to move into other positions and how that promotional process has an impact on the rest of our positions. We also tracked the separations by reason in the actual monthly joint chairman's report. So we were actually able to break that down, and the number of separations by classification. So all of that information is certainly readily available. We also track the number of applications we received, the number interviewed, the number selected, all of that very cleanly broken down in some tables and charts that we'd be more than happy to synthesize and provide to you in one clean packet.
Okay, and thank you very much. And one second question I have deals with the potential closure of the pre-release centers, Eastern Shore and looks like the two that was named earlier. Eastern Shore and Southern Maryland, is that correct?
Yeah, yes.
Yeah, okay,
Yes,
right.
ma'am.
I think there's a concern about what the impact will be as far as available pre-release services, and in particular that part of the state. And I think when you look at it, it probably will only leave one pre-release center, which is probably Jessup, potentially. And what I would like to find out is some insight on the thinking about what the impact is going to be. Both of those facilities are tremendous in what they're able to do. And so we want to get a little bit more insight. If you need to dive into that issue a little bit further, like I said, we do have a second bite of the apple when we're going through our individual departments, et cetera. But that is something I do know that at least the respective House committee is interested in and finding out a little bit more detail about and the impact there.
Chairman, we would be happy to do that, and we'll prepare in a future presentation for you the methodology around pre-release versus re-entry. Sent an individual not rooting in a bricks and mortar facility, but rooting in a community, and how we're accomplishing that pandemic, post-pandemic, and you've heard me speak with great passion around the focus of a re-entry for all across our state. So we'll be happy to give a very thorough presentation on those thoughts. Thank you.
Sure. One final question, and this is pretty much a generic question, I should say, with all agencies that are dealing with public, large numbers of people, whether employees or whether they're engaging in the public. As we stand within this moment, so to speak, not right now, but in this moment of where we are in the state, how is the department as far as PPE, handling COVID? And I know we talked about some of the initiatives with the vaccine for employees, but I guess the bottom line question I'm asking, which is a little different than probably 10 months ago, do you have what you need as far as PPE is concerned for protection of employees and staff and inmates?
Thank you for that question, Chairman. And I think to be very direct, I have not asked for anything that I have not received and been supported in trying to achieve across our system, and have been, quite frankly, very strongly supported. An example would be the Secretary working with the Department of Environment that offered and brought to us this wastewater testing mechanism that is being deployed at colleges and universities. I mean, our colleagues bringing it to us and saying, this will work for you. So I would tell you there's been nothing I haven't asked for. Our PPE supply at this point is centralized. The burn rates are monitored. We are good. We will continue to roll it out at every turn. Our focus right now is again, testing, vaccination, mitigation, and within all of that, trying to maintain the mission of treating every individual with dignity and respect across our system.
Okay. Thank you so much. I don't see any further questions from the House side. Chairman McCray, do you have any further questions or comments, or recognize any Senate members?
Just a final comment, Mr. Chair. Just once again, want to say, Secretary Green, thank you for your leadership and thank you for your team's leadership. And I just wanted to also acknowledge our budget analyst, Jacob Cash, and just say thank you for the work that you did. Thank you again, Mr. Chair.
Okay. With that, I think we've covered everything.
Senator Peters.
Mr. Chair, I think we were going to, after this hearing, just the senators were going to stay on the line.
I've been texting you, Senator Peters. You got to look at your phone.
Oh, okay.
Okay. Let me put it this way, Mr. Chairman McCray, that there obviously isn't a House issue, right?
No, it's not a House issue, but senators, if you could stay close to your phone, please, within the next
Okay.
5 minutes, that would be helpful. Thank you.
Okay,
good.
well, I think we're concluding, and for the public, we do apologize for the delay, but that is one of the things that we're doing as we're jointly hearing the analysis for all the agencies and departments. And in the long run, it may have been a short delay, but in the long run, it will be much more efficient and effective as we're going through this process. And with that, everybody stay safe and thank you very much. That concludes our